Hi everybody. As you can see here, I thought we might revisit coronavirus. I have a couple of things to update you with. Really wasn't sure what to call the stream because I didn't want to particularly alert YouTube that I'm talking about coronavirus. I know that's one of the things that can get your channel unwanted attention. So why I thought about this, I was challenged by a friend. Now the friend that I'm talking about is a very big COVID skeptic, has been since the start. Lately, I think the saturation coverage on the news and now this big media push that started last week for the masks and everything has been getting to her, and she's beginning to say, how do we know? How do we know that? What if the government are right and all that? So I thought, what would be a way of addressing this without getting overly complicated? A way of just putting this into perspective without kind of getting into all the various, of course, there are doctors out there who have loads of different opinions and they go into loads of detail. So I thought, how can we address this? And I'd like to start, I know I've got the chart up here of the cases, which I'm going to look at some statistics also to make things really clear that we just don't know what's going on here, but we can suspect that there's some kind of fix that's in. But think about the masks, right? I'm going to give you an example. Say, for example, you are on a Wimbledon practice court, which we would have been in Wimbledon around about now. Unfortunately, we're not seeing any tennis, which is really awful. A friend of mine tells me that they play like canned cheering at the soccer. That is so fake. Are people accepting this? It seems to me almost sheeple-like that people are just willing to watch soccer matches where there is no crowd, but you're being played fake crowd noises. It just plays into the whole thing that we are living in a more and more simulated world with more things that are fake, and it makes you think, what can you trust? Obviously they know that the applause is fake, but when are you not going to know that something's fake? Basically, you can assume it's pretty much all the time. So you're at the side of the court, Novak Djokovic is knocking up, and he says, oh gosh, I can't find out. He's about to knock up, he breaks a string and he can't find his tennis rackets. And you say, don't worry, Novak, I'm an amateur, I've got a tennis racket in my bag, I can lend it to you. I mean, he's going to laugh out loud and say, you out of your mind, I'm not going to use your tacky, cheap tennis racket. My tennis rackets are made to extremely high specifications. Which brings me to a word, specifications. Everything when you go to buy a computer, from the most complex item to the least complex, there are specifications that you can look up. There are certain standards. When you buy products, like I say, from things that are immensely complex to things that are extremely simple, like a highlighter pen, like a barrel of cotton, they will be either British Standard approved or South African Bureau of Standards approved, Australian standards, European standards. However, when it comes to masks, we don't face that problem. The government tell us, just wear a mask. You can go Johnny Depp style and put a bandana around your face. You can put a scarf around your face. You can wear one of those paper-thin masks. You can wear a big mask. I mean, if you go to a hardware store and look at masks, they'll have ones specifically for paint, ones for dust, ones for sanding and sawing. But when it comes to COVID, basically any mask will do. They haven't specified a size, a material, a scarf will do. Basically, wear a t-shirt, pull it over your face. Don't get too worried about it. Doesn't that strike you as very, very odd? Also, there's no guidance on how long do you wear that mask, or that you should dispose of it after 20 minutes because it's saturated with water vapor and germs and is unhealthy, or that you should not wear a mask again. I mean, the same mask a few hours in a row. I mean, I did see a man come out of a shopping supermarket. He had gloves on and a mask. He disposed of the gloves right away, but he took the mask off, put it in the back seat, and was probably going to use it again. So do you see that this whole thing about masks must be a nonsense? Because if it was true, and if masks did help protect you against COVID, they would have to issue some sort of guidelines as to what sort of mask, how long you should wear it, etc., etc. Like anything. I mean, you can buy a very, very cheap detergent at the dollar store that doesn't work, or you can buy a more expensive detergent that does work. Quality matters in things like this, and yet there's absolutely no quality control over the masks, which I think can tell us all that masks do not work. There's no science, there's no thinking. It's just, again, part of it's actually psychologically, it's part of shaming. It's making people feel like a number. It's depersoning people, and therefore it's making them more malleable and pliable. And it's also quick and easy to see who is complying. So there you go. Now, the next thing that alerts me to the fact that something is very, very wrong here. Let's just look at these numbers. So obviously here you've got the USA, very big country, as is Brazil, India, and Russia. These are some of the top sort of 5 biggest countries in the world, excluding China, and they have massive populations. So it's rather unsurprising that they have got a lot of cases, right? In America's case, you can see they are doing a lot of testing. There you go, total tests 43,000, etc. But aren't you rather stunned to see at number 6, Chile? A small country, they've only got 19 million people, as you can see in that column, and yet they are here, 6th in the country with the most number of cases. It stuns me, especially as my best friend lives in Chile. We're in frequent communication. She tells me that her sons, who are age 16 and 14, have literally not been out the front door since May. That's nearly 3 months. And I know that I spoke to her around about early May, because it was my birthday, and her boys hadn't been out then. They weren't allowed out in the garden. There are very strict restrictions in Chile. My friend is able to only go out twice a week. She doesn't have a dog. If she had a dog, she'd be allowed to walk the dog twice a week. She has to download a form from the government, and before she can go out, she has to have that form with her. She may only be out for 2 hours. Oddly enough, they can have their nails and hair done, but the restrictions on adults going out are very serious. Children are not in school. She's a teacher. She's been doing homeschooling. So it seems to me that if these restrictions work, they are not working for Chile, despite the fact that they are so strenuous, which is why Chile is so high on the list. Or it tells us that there's something wrong with these numbers. Now, as you can see there, Chile's doing a lot of testing, 68,000 per million of population. So they do a lot of testing. Russia has actually done a heck of a lot of testing, 158. And as you know, the PCNR tests, they're going to show up COVID, because it sometimes picks up other RNA diseases like measles, polio, other coronaviruses, so they're highly unreliable. So obviously the more you test, the higher numbers you get. But if you look at this ratio here of deaths per million of population, India are showing up at only 17 deaths per million, Russia 78 deaths per million, Chile 365 deaths per million, and America 417. Now Chile, as I know from my friend, is a rather good healthcare system. I'm not sure if there's massive inequality in some areas of Chile where poor people are maybe more susceptible, but really the variation in those statistics seems quite shocking and seems indicative to me that, you know, with this coronavirus, some countries are inclined to hype it up and to over-report. But let's quickly look at 2 other examples, and that's South Africa. And I'm also surprised to see South Africa's now at number 10, UK at number 9. I'm pleased these countries are together because I want to compare them. They have very similar population sizes. There's South Africa nearly 60 million, UK 67. I'd say South Africa is probably far closer to 67 million, but it's close enough. Here's total cases, very little difference. UK 290,000, South Africa 287. Now South Africa have also had a very serious lockdown. They have to wear masks in cars. They've banned alcohol and cigarette sales. Not sure how that's helping. They've had a curfew. They have had a pretty strict lockdown, although I feel that their cases will probably be higher because in the deprived areas, lockdown is virtually impractical and unenforceable. So that could result in a high number of cases. But if you look at the tests, hardly any testing going on in South Africa to get all those cases. The UK's got one of the highest rates of testing, according to this. They testing like crazy in the UK, which gives us so many cases, of course. But look at this discrepancy. Deaths per million of population, despite the fact that all other things are pretty similar. South Africa, 70 deaths per population, and bearing in mind it's a country with huge disparities between rich and poor. UK, where you've got the National Health Service, 660 million deaths per population. That's a massive difference, which I don't think can be accounted for by any kind of demographic differences, right? So what the heck is going on? There's a huge amount of inflated deaths going on here in the UK. Come on, UK, what's going on? So to continue, let's talk about, now where do you think Japan is on this list? Now Japan's got a massive population, highly urbanized, people living extremely close proximity. Japan is right next to China, where this whole thing started. It's also extremely close to South Korea, which had a massive outbreak. So here you have Germany at 16, Turkey at 15, Italy at 13, Iran was quite bad in Iran, 11. Where do you think Japan is? Well, let's keep going down the list. You're going to find we have to go all the way to number 56 to find Japan. Total number of cases, only 21,000, and there you go. Under 1,000 deaths in a country of, there it is, 126 million. Deaths per million of population, there it is, 8. 8. You want to tell me what Japan is doing with the rest of the world? Was their lockdown incredibly stringent in Japan? I haven't heard that. They have had measures. I hear people saying, well, people wear masks regularly in Japan. I'm not sure if that accounts for it, because people would still be spreading it within the home, and people are still spreading it in their hands. A lot of people in Japan, by their hands, a lot of people in Japan live in high-rise buildings, in flats, etc., etc. So any place like that, it's going to spread. It doesn't only spread, through the mask. And I contend that masks are ineffective anyway, or they would have some sort of standard model of masks, which they certainly don't. So you see, something absolutely extraordinary is happening here when you look at Japan's figures. It's just not credible. Either Japan are hushing the whole thing up to save face, which is possible in Asian countries, or there's a fix-in. If you look at Switzerland here, the numbers are very low as well, although much higher deaths per population than Japan, but also a fair amount of tests going on in Switzerland, and again, the rate very low. So there's huge disparages between countries. Now, we're not going to look at all the third world countries. We know a lot of countries aren't doing any testing, but we also know that the more testing you do, the more your numbers you find. But it's quite interesting to look at deaths per population, because there is a massive discrepancy. So when you think about the lack of science behind the masks, and you think about the huge differences in figures, I'm sure you guys will look at these figures and you might relate it to countries where you live, or countries you know a lot about, and think to yourself, what the heck is going on? These figures just do not add up. There are no sort of trends across countries, trends across Western countries, etc., etc. I think we may as well have a quick look at Germany here and see how they're doing. Germany, only 109 deaths per unit of population, compared to Spain at 608, and how many was UK? 660. Italy, also high rate of deaths, and as you know, as I told you guys, I heard from a source in Germany that they were using the hydroxychloroquine and zinc from very, very early on. So that makes me think as well. In Germany, I'd say their lockdown was probably less stringent than the French and Italian one, yet they're reporting a very low number of deaths. The infection rate is fairly high, they're at 16 in the list, but very low number of deaths. So there are huge questions to be asked here. I will end off by saying, a lot of us look to Russia and we like a couple of the things Putin is doing, throwing out George Soros, being harder on the banks. It's rumored that he is kind of on a nationalistic course for his country, and there certainly are things he's doing right, and yet Russia are under lockdown. Russia also, perpetuating the coronavirus story, if you want to look at that way. Tons of testing going on, the numbers, they're shooting up the charts. So Russia are pretty much on board with the thing, and so are leaders all over the world. They're all on board with this, and I will liken this to the Jeffrey Epstein affair. Do you mean to tell me every secret service in the world was totally oblivious to what was going on there? Well, MI5 were obviously totally oblivious because they weren't warning Andrew off. And, obviously the CIA were turning a blind eye, Mossad were turning a blind eye, the rest of them, the French Secret Service were, because we know that a photographer living in France was key to the whole operation. So all these intelligence services, so-called, they work together. And if you want to use another example, think of 9/11. Did any of the security services across the world come out and say in public, wait a minute, there are lots of countries that are aggro to America, China, Russia, Iran, they could have come out and said, we have evidence that this whole 9/11 thing doesn't add up, that there's a total hoax, a partial hoax, or there was a cock-up. They could have said lots of things about it. Never did, because they all stick together, because pretty much at the core they're all controlled. And we need to bear that in mind when we look to any of these agencies for hope. We need to bear this in mind and say, look, they all act in tandem. There's never a country that's standing up and calling out the hoax, except maybe the president of Tanzania, who was talking about how anything from a pawpaw fruit to a goat can test positive for coronavirus. And I believe even on the Australian health ministry website, they mention that these PCR tests can pick up all sorts of things, and they do give false positives. So, if you look at a lot of these agencies within their websites, they are giving you the true story, but they know no one's really bothered to look at those websites, and the mainstream media certainly aren't going to report it. I think while we're on this chart, we should just look briefly at Australia. I've lost track of where Australia were. They've got the whole of Melbourne under lockdown, with the police and everything. It's an absolute police state, and Australia seemed to be very gung-ho about this whole corona thing, despite the fact, yes, here's Australia, despite the fact that, look, 108 deaths. There are 108 deaths in Australia. They've had a pretty stringent lockdown. They are not allowed travel between the different states, and at the moment, virtually the whole of Victoria is locked down. For 108 deaths, guys, do we stop car travel because of 108 road traffic deaths? This is absolutely ridiculous. So you see, the Australian government, we also looked to old ScoMo, Scott Morrison, thinking he was going to maybe stick his neck out a little bit in true Aussie fashion. He's not. He's absolutely milking this whole lockdown thing to the max. So, as you see, Norway here, way down the list. Norway have handled it very well, but those more deaths than Australia. But there you go, deaths per million of population, 47. Let's look to Norway, and even Sweden, who didn't have a lockdown and who were much criticised for not having a lockdown, are at quite low down the list. I've lost track of where they were. They're certainly in the 20s or in the 30s. Let's see. Sweden, there, 27. Their death per population, 548, is pretty high considering the UK 660. So maybe they're also doing a little bit of overcounting there. But all these figures are subject to so much subjective manipulation in terms of how they're counted. And when we look at all the changes going on in the world, all the push for vaccines, I mean, it's really disappointing to see President Trump wearing a mask now and getting on that bandwagon. And how quickly we went from last week, Boris Johnson saying masks are advisable but not compulsory. Probably tomorrow they're going to make them compulsory. And the vaccine could be like that. It's advisable. Oh, now it's compulsory. Look how far they are pushing it. Now, I believe there's a page on the World Economic Forum website that talks about funding for the coronavirus pandemic, for the response, and this funding is set to continue to March 2025. So they're anticipating this going on for 5 more years. Well, they're planning the funding for 5 more years, but strangely they think it's going to be all over March 2025, which seems oddly very specific. So I just thought I'd bring that to you. It's just a bit more grist for the mill, and if anyone out there is having something to say, there's some information you can throw at them, because I think this is, obviously these statistics do lies, and damn lies and statistics, as they say, but they're indicative of trends that the media or government are pushing out in various countries, and that makes it interesting to look at. Like I say, lockdown does not work, otherwise there's no way Chile would be this high up, right? So any stringent lockdown definitely doesn't work. Okay guys, I think that's it for the moment. I hope you've enjoyed it, and I hope that the things aren't getting you down too much, and when you have to wear your masks, use a bandana, Johnny Depp style. I actually considered whether I should write something on my mask, like I object, but I think it's just better to carry on ordering online. Okay, thanks guys. Hopefully lots more coming up real soon.